Hello, and welcome to Voices in African Health. This is the podcast where we explore the big questions shaping global health and connect them to realities across Africa's health systems, hearing directly from the people driving change. I'm your host, Sharon Quntai. Today, I'm delighted to be joined by Semiha Abdulmelik from the Open Society Foundation and an expert in gender, security, and peace building. Her insights are especially timely as global health systems face increasing pressure, and we continue to ask, how do we build systems that are not only effective, but also just, inclusive, and peaceful? Let's get started. Hi, Semiha. Welcome to today's episode. Thank you so much for joining us. I think I may have not done justice in introducing you. So to kick us off, could you share a bit about your background and how your work has connected health, civil society, and peace, especially through your experience with the Open Society Foundation?
Thank you so much, Sharon, for having me today. So by way of a background, for the past 15 years or so, I've worked on peace building, gender, human rights, civil society across a number of countries in Africa, Sudan, South Sudan, Somalia, Nigeria. I've also done regional policy at the level of the African Union and engagement with ECOWAS. So I kind of have varied experience from humanitarian work to peace building work and governance work more generally at various levels. And maybe just to speak about this connection, Sharon, that you've mentioned between health, civil society, and peace, and how through the work we're doing at OSF, my current work with OSF is through the Transformative Peace in Africa program. And a key aspect of this program has been at how we look at peace, not just through a political, but a social lens. And so in this regard, we need to really acknowledge the deep psychological impact conflict and violence has, not just on individuals, but communities as a whole. So a lot of the work that we support looks at addressing mental health in particular as a key element of peace building and conflict transformation. It looks at how forms of trauma healing, particularly those that are culturally relevant, tap into innovative practices such as arts and culture, address individual and collective healing, and are also co-designed with survivors, particularly survivors of conflict-related sexual violence, and affected communities can be supported. And so also, it's looking at how access to relevant health, particularly mental health services, can be part of redress and justice mechanisms for communities coming out of conflict.
That's such a powerful overview, and it actually leads us to our second question, which I think you've sort of touched a little bit on, which is the interplay between these different sectors. So I'm just wondering then, from your perspective, because you've talked about how peace is already linked with these different sectors, how do you think the lack of peace specifically, shapes equity in health systems, especially in Africa?
Yeah. So, I think I want to start by saying that there is a growing movement that's seeking to understand the interplay between peace and health very broadly, but also not just the impact of conflict on health systems, but also how health systems and institutions play a role in peace building. But maybe just to say that if we look at it very much, let's say, at a macro level, we also need to see how conflict, militarization, securitization can divert resources from critical social services and infrastructure, like health, into war. So I think we need to acknowledge that very much at a macro level. But I think active conflict, affects the functioning of health systems, infrastructure, health workers are displaced. What we're seeing in a lot of contexts across Africa and globally as well, where you have conflict, is attacks on health facilities, looting of supplies, and particularly the displacement of health workers. So in a sense, you've also seen where conflict has resulted in the collapse of both either local or national state systems. You also see where there's, health workers are not being paid and therefore not being able to do their work. So I think we need to acknowledge the ways in which conflict affects, both health systems, infrastructure, and particularly health workers as well. I don't want to, forget the individuals that make up this system. But also when you look at it from the point of view of communities and individuals and affected individuals, I think conflict can affect the accessibility of health services, particularly for isolated and vulnerable groups, such as newly displaced populations, where individuals, communities, groups are displaced into areas where there are insufficient health services or infrastructure. And, there's also a very gendered element to this because women and girls have very particular health needs, which in the context of conflict become very difficult to address. And it's made even more so difficult where you have women and girls who are affected by conflict-related sexual violence and require additional services, health services, mental health services, and broader services to be able to support them.
Absolutely. Wow. That is very, very clear for sure that health and peace are very, very interlinked and need to be part of the same conversation. And this also brings me to the recent Faith to Action Network convention where you are a panelist. And this is one of the key things that came up. What do you think are the roles that faith leaders and community-based organizations play in advancing health and justice, particularly, as you mentioned, gender? So around gender, reproductive health, and inclusion, what roles do you think these two groups do play in advancing health and justice?
Yeah. No, I mean, I think, these faith leaders, faith actors, and community-based organizations play really critical roles, both as advocates for progressive values, for defense of rights, for being voices for inclusion. But I think we also need to ensure that we don't lose sight of the fact that faith actors and community-based organizations are also doers. They're also providing services. They're also part of service provision in the context of reproductive health, in the context of gender, in the context of pushing for peace. So I think both as advocates, as doers are incredibly important. And when we're speaking about faith leaders, I think there's another additional dimension in terms of the fact that as faith leaders, they have a certain moral authority.
Right.
And they also serve as a bridge between, let's say, their communities or constituencies and political elites or politicians or policymakers. And that they have this ability to kind of shift between community level, political level, and national level. And therefore, they're bridging and elevating local voices and perspectives. And then maybe just lastly to say that often what we see is that faith actors tend to organize and coalesce around platforms and networks, whether they're interfaith or interfaith, and therefore they kind of have this extended reach or constituency that can be used for collective action, messaging, etc. So I think, how they work and how they organize themselves is also really critical to acknowledge in terms of how they're able to push this agenda.
Absolutely. And yeah, I totally agree on that because what we saw even having the discussion at the Faith to Action Network event is that faith leaders do have that credibility. They have that trust in the communities. So working together with community-based organizations means that they can create more impact, that they can reach more people. So I absolutely agree on your points about how these two different groups can play a role in advancing health and especially justice. And another conversation still to keep you on gender, Another important thread in this conversation is gender equity, especially when it comes to the role of women leaders in these spaces. So we are seeing growing conversations around women leadership in both health and peace spaces. So from your experience, do you think the gender balance is shifting in the right direction? And what more needs to be done to make women's voices, especially, to be central in these discussions?
Yeah, I mean, I think we also it's a bit of a mixed bag, right? So we've had a lot of gains in terms of, let's say, the numbers of women within these spaces, particularly, let's say, at a policy level. I mean, we can talk about these spaces kind of at a policy level and more at a local level. But I mean, clearly what we see is that there are more women working in these spaces who have expertise, who have capacity. There is increased representation. But I think the big question is really around influence, right? So to what extent have these larger numbers been translated into being able to influence gender responsive or socially justice oriented decision making or policy? So I think that there really is this issue around influence. And I think we also really need to acknowledge that currently we are at a moment where there is quite significant pushback on women's rights, whether it's around language, whether it's around substantive rights, etc. So, and this is manifested not just globally in our global institutions and policy institutions, but also very much in our local spaces, in our national systems as well. So it's a bit of a mixed bag, I would say. But if you look at and you kind of see the same thing translated at a local level, right? Women are frontline responders, whether it's peace building, whether it's conflict resolution in between communities, whether it's health provision around community health provision. But they also face very particular risks as they're undertaking these roles, whether it's gender-based violence, whether it's, threats, online harassment. And they also continue to face resistance from traditional actors, particularly when we're talking about peace building. And we see that in contexts like Sudan, where really women have been at the forefront of peacemaking, but have found very little space. And not just women, but also young people have found very little space in traditional authority or traditional, let's say, dispute resolution mechanisms and amongst these traditional actors. So what needs to be done, I would say, really is that collectively as funders, philanthropies, we really need to be very intentional about providing support to these pockets of resistance and be able to also create messaging that counters this pushback on some of the very important gains that have been made on women's rights and the gender balance we see across these different spaces.
Right. And that's quite powerful and important for us to think about, especially as we talk about what the future of global health and peace look like. And looking at how specifically institutions respond to times of crisis or in times of crisis. In your view, how can governments and local institutions work together more effectively to build resilient health systems, and especially during times of crisis?
Yeah. Look, I mean, I think there's one critical element is really to the extent that state institutions work with local actors and ensure that health systems are decentralized, are owned by communities, and are also flexible and adaptive to, whether it's a conflict-related crisis, it could be it could be a natural disaster, it could be other kinds of shocks, right? So what this means is that communities often have the solutions for their problems. So really, these health systems need to be co-designed with the communities.
Right.
They need to be flexible and adaptive because we're seeing multiple shocks, whether they're climate shocks, economic shocks, the poly crisis that we talk about quite often on a global level is also felt very much locally. So if state institutions work with local institutions and community organizations to co-design these very flexible health systems that are decentralized, they're owned by the community, and they're also innovative and responsive. For example, the issue of mobile clinics to address, the health needs of IDPs or internally displaced persons. This is a mechanism that is responsive to the fact that conflicts induce displacement, and that doesn't mean that displaced people do not require health services. So I think also thinking very innovatively about what kind of approaches, and this also includes issues of resourcing as well.
And that brings us also to a broader challenge, because even in long-term development efforts, there are still some key gaps that we can see currently. So in your line of work in advocacy across human rights, peace, and governance, what are some of the biggest gaps that you've seen in how global health efforts incorporate these dimensions, and how do you think they can be addressed?
Yeah. So, I think often there is this issue of silos, right? These different sectors or systems tend to work in silos. And you have, health entities, human rights entities, peace and actors really working in silos. And there have been many different approaches to see how we can work across, they call it the peace and development and humanitarian nexus. So I think really it starts in terms of how do we do collective planning that is across sectors, or, very much at within the context we're working with. So we're not just doing planning of health systems in isolation of the peace and conflict context, the human rights context. And I think also there needs to be kind of a shared understanding of, what we spoke about earlier, Sharon, in terms of the interlinkages between these things. So I think there needs to be policy commitment that they're very much globally. And I think we've started to see that. And then that policy commitment and shared understanding really needs to be trickled down in terms of how we do planning, how we do resourcing, how we do programming, how we do advocacy.
And just looking ahead beyond filling gaps, because you've mentioned earlier about redesigning strategies, what does it actually take to redesign systems to be more just and inclusive?
I think, there's whenever someone asks me about change, I always recall this kind of inverted triangle where there's kind of the easiest section of work that we're faced with, which is changing policies, legislation, etc. And that's relatively easy. And then there's kind of this other secondary layer, which is slightly significantly different, which is how do you change relationships between actors? How do you change resource flows? But really at the heart of it is how do you then change mental models, right? How do we move beyond saying we're putting the, health systems that are people-centered, that, are also attuned to peace dynamics? I think there needs to be a broad-based change in the mental models we hold as practitioners and policymakers and decision makers. So I think the first layer of kind of policy frameworks, legislation is relatively easy. And I think that is we're slowly starting to see that. But this kind of movement and change in how we, in our mental models and how we understand these things, how do we have a holistic understanding of health and what that means for peaceful societies, what that means for resilient societies. So all these three things go together, kind of that broader policy change, kind of the resourcing and political and change, and then kind of the deeper mental change that's required from our governments, from our communities, and also from practitioners on the ground.
Right. And I think, of course, the conversation now through, especially when you go to global health events, when speaking to global health experts, now the conversation is very much looking into Africa. And I'm just wondering, the next generation of leaders will be the ones carrying this work forward. So when you think about the next generation of African leaders working across peace, working across health, what gives you hope and what would you like them to do differently?
What gives me hope? I think what gives me hope is that what we're seeing is that despite the challenges they face, whether it's conflict, whether it's lack of resources, whether it's constrained civic space, etc., what we're seeing is a leadership that is resourceful, which is innovative, and which is really focused on what is needed in the moment. And also what we're seeing is very much solidarity and learning across borders. So I think this really gives me hope on the continent. And really there's a growing movement, and we see it in Sudan and the work that was done in the past 2 years while the conflict continues to happen. Really, we're seeing the agency of local actors, right? And not just the agency, but the leadership. And they're creating solutions in the absence of an international community that either is absent because of a lack of resources or because of conflict, etc. So what would I like them to do differently is to really be able to tap into this kind of period of what I call experimentation, to be able to change systems, right? A lot of this has been reactive. It's been in response to conflict, in response to a lack of resources. And what I would like this leadership, this very critical leadership to do is be able to move this to shifting systems completely, right? And to be able to look towards the future in terms of recreating the landscape for peace and health work and the associated structures. Because a lot of, humanitarianism, peace-building sector, the humanitarian sector has really been confronted in the past 4 or 5 years, and local actors have been able to come up with their own solutions. But we need to be able to then not just look at present solutions, but see how we cement these and concretize these solutions into long-term systems for our continent.
Absolutely. And that's quite exciting to hear what vision that you have and what, the hope that you see for African leaders. And just to close us out, if you could leave our listeners with one key takeaway, what would that be?
Yeah. Well, look, I think we maybe started talking a bit about the peace and mental health connection. So I really just like to reiterate that, peace for us is a positive condition of society. And peace cannot succeed if trauma and mental health is ignored. So really what I would like to leave the listeners with is the need to center mental health and peace building and vice versa.
Great. Thank you so much. And that's quite wonderful for us to digest and think through. And I'm sure that our listeners will find these perspectives very important. Thank you so much for joining us, Semiha, and for sharing your insights. It's very clear that the future of health is, Africa and beyond. And it does not just depend on medical solutions, but on the leadership, justice, and peace that surround them. And I know that our listeners will learn quite a lot from this discussion that we've had today. So to our listeners, thank you for tuning in. This has been Voices in African Health. Be sure to follow us on Podbean, Spotify, or Apple Podcasts so you don't miss future episodes. Until next time.